Well, good morning, everyone. Before we begin, I'd like to acknowledge the land on which we are gathered as the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and now is home to many diverse First Nations, Inuit, and Métis peoples. I would also like to acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. I would also like to acknowledge that we are in the Mary Fix House. Mary Fix was a celebrated politician and philanthropist. As a 16-year-old, she worked to secure voting rights for women, was one of the first women lawyers in Ontario, and one of the first women politicians in Toronto Township, which is now the city of Mississauga. So welcome. My name is Robert Ridge, and I'm the Executive Director of Distress Centres of Greater Toronto. I'm pleased to be with you today for this important announcement, which will help racialized communities across crisis and distress line services that take into account their unique needs. I'd like to welcome the Honorable Yara Sachs, Minister of Mental Health and Addictions and Associate Minister of Health. The Honorable Yara Sachs was first elected as a Member of Parliament for York Centre in 2020. She has previously served as the Parliamentary Secretary to the Minister of Families, Children and Social Development. She is also a member of the Standing Committee on Environment and Sustainable Development and the Standing Committee on Foreign Affairs and International Development, as well as various parliamentary associations and interparliamentary groups. Minister Sachs is a longtime community advocate and leader focused on promoting health and addressing inequalities in society. Before entering politics, she was a successful small business owner and the Director of Trauma Practice for Healthy Communities, a Toronto-based mental health charity working for better access to mental health services. Minister Sachs brings a Canadian and a global perspective to her community engagement work, and she's held advisory roles in policy, communications, and project management, having worked in the office of the Mayor of Jerusalem on the Israeli-Palestinian peace process. Minister Sachs holds a Bachelor of Arts in Political Science and Middle East Studies from McGill University and a Master of International Relations and Diplomacy from the Hebrew University of Jerusalem, and she is the mother of 2 daughters. I'd like to invite Mr. Sachs to the floor.
Thank you so much, Robert, and good morning, everyone. It's wonderful to be all together here on a sunny Friday morning here in the GTA and at the Mary Fix House. I love that strong women have been leading us in spaces here in the GTA for generations, and I'm honored to be a part of that legacy of amazing women who are doing better for our communities. Before we begin, I'd also like to take a moment to acknowledge the land on which we gather. It is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many First Nations, including Inuit and Métis peoples. It is covered by Treaty 13 with the Mississaugas of the Credit, but I'd also like to acknowledge that we share these lands with our First Nations peoples. It is an opportunity for healing, bridge building, and really moving Canada and First Nations forward together in what can be the most healthy and diverse and resilient Canada, which brings us all here today of how we meet each other where we are at on these sacred lands. I'd also like to take a moment to thank the Distress Centre of Greater Toronto for having us and hosting us. For decades, this incredible organization has provided care, compassion, and support to people in crisis here in Toronto. Thank you for always being there when you are needed the most. And thank you so much for hosting us here today. It means a lot to be in this space. I'd also like to take a moment to acknowledge my colleague, MP Charles Sousa, who is the MP for this area. He is a tremendous advocate for his community and is very busy in the House today representing his constituents and Canadians. We know that when people are in crisis, they need immediate support. That's why the services of distress and crisis centers are so essential, especially for those who may not know where to turn to help in that exact moment. Today, I'm deeply honored to share the news of how our government is further enhancing Canada's crisis and distress line sector, because you are so critical to meeting Canadians where they are at in the moment that they need you most. Through the Distress Line Equity Fund, we will be supporting an initial 19 organizations across the country with an investment of more than $3.5 million to address gaps in equity, diversity, and inclusion. This funding will help these organizations to build their capacity and their ability to respond to the diverse needs and experiences of every person who reaches out to them. Just before this announcement, we were talking about how Toronto is really one of the most diverse cities in the world, but it can also be the loneliest, especially for our newcomers and communities that from all over the world that choose to make Canada home, and to know that distress centers really hear that you do that work of making sure that they are seen, heard, and feel included in moments that are so hard and challenging is really a testament to who we are as Canadians and the promise of coming to Canada and creating a safe space and building a home here. Today's announcement is part of a broader federal investment of $8 million to the Distress Line Equity Fund, and it represents more than just a financial contribution. It is a thoughtful approach to ensure equity-deserving communities receive crisis and distress line services that consider their unique needs. Organizations receiving this funding will be investing in staffing, training, competency building, and helping to remove barriers to serving diverse communities. I would be remiss if I didn't note that next week is Black Mental Health Week. It's an important opportunity to acknowledge the impact that anti-Black and systemic racism has had on the mental health of Black community members across the country. I'm proud to announce that a portion of this funding, $250,000, is directed towards the Distress Centres of Greater Toronto. With this investment, the Distress Centres of Greater Toronto will be able to expand the availability of their multilingual distress line services to be able to operate 24/7. And just earlier we talked about, is it 7 or 8 different language lines that are available through their services, which is incredible to know that so many of our residents in the GTA can access help in the language that they're most comfortable in. This funding will also be used to help reduce mental health stigma through targeted education with racialized communities. Equally vital is the initiative to increase the number of diverse distress center volunteers. Volunteers are the backbone of these organizations, and there's a need for diverse voices and experiences at the forefront of mental health support services. When someone is in crisis, they want to be able to meet and speak to, whether it's by phone, by Zoom, or however they connect with them, to someone who truly sees them and that they see themselves back. And I can't emphasize that how important that is in ensuring that we have diverse, culturally appropriate services. This funding will also help Distress Centres of Greater Toronto to further develop their internal equity, diversity, and inclusion competencies through comprehensive training with new staff and volunteers. Finally, with this investment, the Distress Centres of Greater Toronto will conduct research to better understand the mental health needs of racialized communities. Research is not just an academic pursuit. It is a tool to inform future service provision, ensuring efforts are targeted and effective in addressing the unique challenges faced by our communities. When we know more, we can move better together. As Canada's Minister of Mental Health and Addictions, I am so proud to work hand in hand with organizations like this, because you show up each and every day to support Canadians. And for that, I am truly grateful. Because we know when it comes to mental health, we can't work in isolation. Toronto has been named a lonely city, and if we are going to begin to connect communities and connect individuals, young and old, the work of Distress Centres of Greater Toronto amongst our many, many organizations that help and reach out, and also are aligned for those who want to reach out, create those bridges so that we can have communities that are resilient, connected, and strong. Because we know we're stronger when we work together. This investment that we're announcing today marks a significant step towards building the more inclusive and supportive mental health system that we all want to see happen and be built. By addressing critical gaps in equity, diversity, and inclusion within distress and crisis centers, we're ensuring that everyone in Canada, from all backgrounds, from all cultures, and from their diverse experiences, have access to mental health resources when they need them. I want to thank the Distress Center and all of the other incredible organizations who are here today, and also for the invaluable work you provide every day, because you are so dedicated and you work so hard. And it's often that voice on the other end of the line. We may not see you in person, but your voices are heard, and we are so grateful for the work that you do. I'm really grateful for your attention in making sure that Canadians move forward with opportunities to have positive mental health experiences so that we can build a Canada where everyone is living in a place of safety, both emotionally, physically, and mentally. Thank you so much for the work that you do, and thank you.
Thank you, Minister Sachs. Many people in our community struggle with anxiety, depression, and suicidal ideation, and are often lonely, isolated, and stigmatized. Our highly trained volunteers provide peer support and a non-judgmental ear. We want to make sure that everyone in the community has access to our services in a way that makes sense to them. In order to do that, we need to reach out and attract volunteer talent from all communities. We need to understand the barriers that may prevent those in crisis from seeking support. We need to understand what the specific unmet needs of racialized communities are. And we need to build internal competency with respect to equity, diversity, and inclusion. Funding through the Distress Line Equity Fund will enable us to extend our multilingual distress lines to 24/7 service, to reduce mental health stigma by providing education in racialized communities. We'll increase the diversity of distress center volunteers. We'll develop internal equity, diversity, and inclusion competency through training for new staff and volunteers. It will allow us to conduct research to better understand the mental health needs of racialized communities. We're very grateful to Minister Sachs and the Government of Canada for the generous support from the Distress Line Equity Fund. It will help ensure that all members of our community have access to 24/7 crisis support in a manner that works best for their needs. It will help us address the barriers that are currently limiting access to immediate crisis support. And as a small volunteer-driven organization, the financial support is especially meaningful. Distress Centers was one of the first organizations in Canada to offer multilingual crisis lines. I'd like to thank my predecessors for their forethought in responding to the emerging needs of our community. And of course, a big thank you to our volunteers and staff on the front lines for providing critical support, often under very trying conditions. Thank you for coming out this morning.
We're going to begin the question and answer portion of the event. We will now proceed to questions from journalists in the room. Please state your name, media outlet, and whom your question is directed to. Nous allons maintenant passer aux questions des journalistes présents dans la salle. Veuillez indiquer votre nom, votre média et le destinataire de votre question. Let's proceed to the first question. Nous allons passer à la première question. Okay, no questions here in the room. Merci. We will pass to the Zoom now for any further questions. Nous allons passer à Zoom maintenant pour toute autre question.
Merci beaucoup. Si vous êtes journaliste et vous désirez poser une question, veuillez utiliser l'option de lever votre main. If you are a reporter and wish to ask a question, please use the hand raising function. All right, so there's no questions on the Zoom either, so this will conclude our event. Merci beaucoup.
Thank you, everyone.
Thank you.